Hi, my name's Phil. I'm 43 years of age. I live in the south coast of England with my 3 kids and a dog, and I'm currently suffering from heart valve disease. So I wanted to make these video blogs, diaries, just to document what I'm going through, what are the challenges that I'm facing, and also what are the emotions and the situations I'm being put in over the next few days and next few months. So about 2 years ago, I collapsed and ended up in hospital, and lots of tests were done. I didn't fit the typical profile. I was 42 at the time, living a healthy lifestyle, doing lots of cycling, 50 to 80 miles a week. So I was out on the bike a lot, and so I didn't really fit the typical patient, if you like, and lots of tests were done. They found an issue with my heart valve and some regurgitation, which means blood comes out of the heart valve back into the heart. So the heart's working a lot harder than it needs to. And I was sent away, and then I came back into hospital last year, the end of 2020, had some more tests and was referred to my heart surgeon. So I collapsed again just before Christmas. So I also now know that I suffered then from atrial fibrillation in these situations where I passed out, and that has led to me having more tests and now getting booked in for heart valve surgery to repair the valve. My symptoms really are, I'm very tired, suffer quite a bit from fatigue. I also suffer from shortness of breath, so you might hear in the video and other videos that I'm sort of gasping or trying to catch up on my breath. But I'm seeing my surgeon tomorrow, so it's a big day tomorrow because it means that I'll be able to talk through what the operation looks like and also how long I'm going to have to wait. Obviously, COVID's had a massive impact on that, and there's lots of patients like me that are waiting for surgery and have been put off. And I'm now waiting. I'm on that list, so I'm hoping that I'm going to get it soon. So I'll keep you updated. I hope this shares about some of the emotions and the challenges that I and all the other patients that are suffering from heart valve challenges and issues are dealing with. So I'll update you more with some videos, but yeah, going to get an early night, and look forward to seeing the surgeon tomorrow. Thanks.
Hi everyone, so yeah, here I am. Today's the big day. I'm in the car park, as you can see. I'm at Worthing Hospital. I've got my appointment with my heart surgeon in the next 10 minutes. So I just wanted to capture a video just to sort of document, if you like, what I'm feeling, what's going through my head at the moment. I think it's a mixture of anxiety, excitement. I'm very positive overall about everything that's happening, but I'm also very aware that COVID has caused lots of delays and pressure and challenges on the NHS and the team that are going to be looking after me. So I don't know how that's going to affect it. You know, I was given an idea of time and waiting for surgery last year, but that was before the latest lockdown, so I don't know what that looks like now, so I want to find out about that. I've got to have a few blood tests as well, so just, yeah, a bit of a mixture of everything. I mean, it's weird being here on my own. I'm just sitting here sort of contemplating what's going on, and normally I'd have my wife here who would be looking after me and also helping in the meeting, taking the notes, or, you know, remembering some of the information we've been given. So as I'm on my own, I'll be just letting the surgeon know I'm going to have my phone out, get my iPhone out, get notes up, and then just document and write any key notes or key information in there, because I think that'd be really interesting. They've got the CT scan as well, so I'll be able to go through that as well. And yeah, you know, just it's so important today. You know, I wouldn't have missed this for the world. This is the pivotal meeting, because this will map out the next 3 to 9 months of my life as to what it's going to look like and how the delay is going to affect me. But what I'll do is I'll put another video out after, when I've got some more information to share. And yeah, I'll speak to you later. Okay, so I've just had my meeting with the surgeon. I'm done. Mixed emotions really. I didn't get a date, so that's a bit frustrating. But on the flip side, I know the challenges that they're facing. And the good news is that it sounds like Brighton Hospital is getting back to some form of normality, and heart patients are being seen, but it's going to take quite a long time for that to move forward. So I don't know exactly when it will be. It could be September, October time at the moment, so it's still quite a way off. And
that's something that I've got to take on board and think about. It's not a massive surprise, but I was sort of, you know, part of me was wishing I'd get a date sooner. I think it's just about really now I've just got to make sure I monitor my symptoms. If they get worse, I've got to put my hand up. I've got to speak to the surgeon and the teams behind him to let them know that's the case, so that I'm not suffering too much. But I hope you've seen today that, you know, super professional, really helpful staff. I've got great rapport with the surgeon, which makes me feel so much more relaxed. And yeah, looking forward to the next phase. Okay, cheers.
Okay, so this is my follow-up video. I've been to see the heart surgeon. I've had my meeting, and I've now just about to walk in the door at home, and I haven't got a date for my surgery. So I'm a bit frustrated about that, but I understand the reasons behind it, and I know that the team want to get me in there as soon as possible. It's just about managing my expectations, I guess, to myself really, of what the next 6-7 months is going to look like without having that surgery. I was a bit out of breath when I walked from the hospital to the car, and then started talking on the video. So yeah, that's something I've got to work with, but overall I'm feeling really positive. I've got great rapport with the surgeon. It makes such a difference. I feel so relaxed and comfortable around him, and we were having a chat about bikes and the procedure, and it's just a real mix of discussion points, and that makes it so much more enjoyable really, is going into those meetings, and I'm not worried about it, and I'm not as anxious as I maybe could be if that wasn't the case. So I really appreciate that. And look, I've got a plan. I think I now understand the importance of the Just Treat Us campaign that Heart Valve Voice are really behind, because although I understood the concept before, I think now I've got them on my side fighting, you know, the case to get patients treated as quickly as possible. That will have a positive impact on me if that happens. And if I get in sooner, it means, you know, more time that I'm going to get back to ride my bike, which I'm really missing, and I'm going to miss not doing that in the summer. That's going to be quite tough not doing that. But I know it's worth it long term, so that really helps. So yeah, that's where I'm at the moment and how am I feeling. And I'll do another video in a few months' time to let you know how it's going on and whether I've got any changes with the heart surgery date. So yeah, that's it from me for now, and I'll speak to you again soon.